Good morning. Welcome back to Open Med School. I am Dr. Andrews, Professor of Medicine and Consultant Neurologist. Last time we have discussed about the interpretation of ABG in a stepwise fashion. First look at the PaCO2. Second you look at the pH. Third, whether the pH change is due to the carbon dioxide. So today we will be discussing about the PaCO2 in the ABG. The normal range of PaCO2 is 35 to 45. When it is more than 45, it is respiratory acidosis because carbon dioxide is an acid and it indicates hypoventilation. So carbon dioxide is a measure of ventilation. Next thing, when the carbon dioxide is less than 35, that means lungs are washing out the carbon dioxide. So that means the respiratory alkalosis indicates hyperventilation. So carbon dioxide is a measure of the ventilation. Now look at the changes. When the pH is low, that is less than 7.35, and the PaCO2 is increasing, it is respiratory acidosis. The pH is more than 7.45, that is alkalosis, and the carbon dioxide tension is less than 35, it is respiratory alkalosis. So here we can use the mnemonic ROM, respiratory opposite, metabolic same direction. That is, in respiratory disorder, when the pH is decreased, the carbon dioxide is increasing. That is why and the vice versa. Hope this point is clear. Then the respiratory acidosis and respiratory alkalosis, we have to identify whether it is an acute one or chronic one. There are two ways for looking at this. One is looking at the pH. The pH change for acute one, that is acute respiratory acidosis and acute respiratory alkalosis, remember 0.8. That is for every 10 millimeter change in carbon dioxide, the pH will change by 0.08. That is, for acidosis it is reduced, and for alkalosis it is increased. I will explain this with an example later. Hope this point is clear. Not 8. For a chronic one, the change in pH is little less, that is 0.03. So remember two numbers, 0.08 and 0.03. Change of pH will be 0.08 for acute respiratory disorder and 0.3 for chronic disorder. By looking at this, we can identify whether it is an acute one or chronic one. Next is I can identify again by looking at the compensation. What is a compensation? That is, when the carbon dioxide changes, the changes will be in the bicarbonate. When the carbon dioxide increases, what happens? When the carbon dioxide increases, the pH will decrease. So it is acidosis. So what will happen? The body will try to retain bicarbonate. So the bicarbonate will increase. So in respiratory acidosis, there is a increase in bicarbonate. Hope this point is clear. So now what is this compensation? For acute one, you remember the rule. For acute respiratory acidosis, every 10 millimeter change in the PaCO2 will produce a change of 1. So that is for acute respiratory acidosis. So I will repeat once more. Expected bicarbonate compensation formula for acute, bicarbonate will increase 1 milliequivalents per liter for every 10 millimeter rise in PaCO2. For chronic one, bicarbonate rise will be 4 milliequivalents per 10 millimeter mercury increase in PaCO2, that is 1 and 4. And for respiratory alkalosis, acute one, there will be bicarbonate will decrease by 2 milliequivalents per liter for every 10 millimeter mercury reduction in PaCO2. That is the rule of 2, and for the chronic one it is 5. So acute one, you remember 1 for acidosis and 2 for alkalosis. For chronic one, acidosis it is 4 and the alkalosis it is 5. So this is, by using these two formulas, we can identify whether it is acute or chronic. Just remember a few mnemonics. One is the ROM, respiratory opposite. pH and PaCO2 move in opposite direction. That is what is meant by the mnemonic respiratory opposite. Metabolic equal. pH and bicarbonate will be moving in the same direction. That is, in metabolic acidosis, the bicarbonate will be, the pH is decreasing, bicarbonate will be decreasing. Then the rule of 1, 2, 4, 5 that I have already explained. Then remember the 0.08, 0.03 change for pH. For acute, it is 0.08 and chronic 0.03. Whether it is acidosis or alkalosis, the values are 0.08, 0.03. For acute one, 0.08 and chronic one, 0.03. For every 10 millimeter change in PaCO2. The next session, we will elaborate this with case examples. Hope it was clear to you. Thank you.